Thank you for joining us, the HU Center for Health Economics at the University of the West Indies, today for a webinar on sugar-sweetened beverages, economic implications and policy options in the Caribbean. I am Charmaine Mativer. I am a research fellow with the HU Center for Health Economics at the University of the West Indies in St. Augustine. Today, we will have a welcome by Dr. Althea Lafourcade. She is the director of the HU Center for Health Economics and a senior lecturer at the Department of Economics at UWI. Following her, we'll have three presenters who will focus on some policy initiatives and on sugar-sweetened beverages, as well as how we can mitigate the risk associated with sugar-sweetened beverages and NCDs. There will be a question and answer segment, and then we'll have a closing by Professor Carl Theodore, who is an advisor to the HU Center for Health Economics. The time is short today. It's just going to be just over an hour. In terms of the logistics and some questions and answer segment, please note that there will be a Q&A chat, and that is where you will put your questions for the presenters. There will also be an open chat where we'll allow you to communicate. So because we're going to have a very tight session today, we ask everyone to keep your questions very short. And I would now like to turn you over to Dr. Althea Lafourcade, who would bring welcome remarks.
Thank you. Thank you. Good morning, all, and thank you, Chair. I would like to extend a hearty welcome to all of you on behalf of the HEU. The HEU Center for Health Economics is a regional institution based at the St. Augustine campus of the University of the West Indies. The HEU's guiding principle is making a difference, and it discharges this mandate through its technical support, training, and research. Over the years, the HEU has deepened and expanded its research agenda through both center-commissioned and partner-commissioned activities. The center has worked both collaboratively with various national, regional, and external agencies, and on its own to provide technical guidance and support to Caribbean governments with the aim of strengthening our health systems. For those who may not be familiar with our work, I encourage you to visit our website for further information on our work in this region. It goes without saying that NCDs pose a significant threat to population health and well-being and the economies in this region. Key to winning the battle against NCDs is attacking the modifiable risk factors. In this regard, we have been working with partners to provide economic and related evidence to impact these risk factors. On our website, we have shared the results of some technical work on taxation of tobacco and alcohol and the potential impact on consumption, revenue, and health outcomes. One of the modifiable risk factors for NCDs is unhealthy diet, and mounting evidence has pointed to the consumption of sugar-sweetened beverages as a contributor to the NCD's burden. This webinar is the first in a series which will focus on sugar-sweetened beverage policy in the Caribbean. The goals of this series are, firstly, to share in-country policies and results so that we can learn from each other's experiences. And secondly, to facilitate discussion on the issues surrounding sugar-sweetened beverage taxation and policy interventions in our Caribbean context. In this first webinar, we feature two countries, Trinidad and Tobago and Barbados. Our next webinar will focus on the OECS, and we will be approaching our regional colleagues, some of whom may very well be in this participating in this webinar to contribute to that undertaking. We believe if we work together and learn from each other, we can turn the tide and mitigate the impact of NCDs on the people of the region. Thank you, and I now hand over to our chair, Ms. Charmaine Metiver, Research Fellow at the HEU, whose portfolio covers health financing and who has been working on issues pertaining to economic policy and taxation with a view to assist in positive health outcomes. Ms. Metiver, over to you.
Thank you, Dr. Lafourcade. And welcome to participants. It's certainly a pleasure that you're here joining with us on this first of our series of sugar sweetened beverages in the region. Our next presenter is Dr. Anton Cumberbatch. Dr. Cumberbatch was appointed Chief Medical Officer of Trinidad and Tobago from 2008 to 2011 and held the post of County Medical Officer of Health for the St. George East in Trinidad from 1995 to 2008, as well as from 1991 to 1992. Dr. Cumberbatch has dedicated his work time to the improvement of public health in the Caribbean. Since 1988, Dr. Cumberbatch has been intimately involved in the health sector reform initiatives of Trinidad and Tobago. He was appointed Chief Executive Officer Designate of the NHIS, National Health Insurance System, and head of the government's counterpart team of consultants. Dr. Cumberbatch is a technical advisor to the HU Center for Health Economics here at HUE, and he's been with us for several years, since 1995. He has been a key member on the team on NHI projects, and he provides support to us, continued support, and he's an active contributor to the health sector reform work of the HU. Dr. Cumberbatch's presentation, we'll be looking at mitigating the risk associated with NCDs. Dr. Cumberbatch, I hand over to you.
Good morning, Ms. Metivier and the staff of the HU and all our guests who are listening to us this morning. Firstly, I want to start in a little different way by thanking the HU for allowing me to share in this webinar and this very important topic with NCDs within the context of the fact that we're having a pandemic. And I will speak a little bit about that to the ending to give you the link to the NCDs and the pandemic. But I also want to specifically thank Dr. Kimberly Ann Gittins-Baines, who assisted me in the research and the production of these slides, and who also will be assisting me in the presentation of the slides. So let us go. Dr. Baines, can you put the first slide up, please? Thank you. While we wait on Dr. Baines to share the first slide with us, I just want to remind everyone that the structure of the presentation that we'll be having, we talk a little bit about sugars and the relationship between NCDs. We also talk, can you go back to the other slide, the slide we can write, thank you. Why sugar sweetened beverages, the economic implications, and the way forward. But before we go to the first slide, I just want to make a point about sugars for us to understand something. It also has a direct link to how we mitigate some of these things. We must understand that I'm happy that we have a nutritionist with us today, that the metabolism of carbohydrates leads us to sugars. Now I would put up a few slides with some pictorial representations really of some organic chemistry and metabolism of sugars, but it's not detailed, but it's just to let us know what is happening and how we get here, but also, most importantly, to make the link, especially for our young people, that sugars coming out of the metabolism of carbohydrates is a good thing, because that is what presents us with energy to function. And here is the first point I want to make, and we must always remember this point. The metabolism of complex carbohydrate is what gives us the energy for us to survive as human beings. If we do not use this energy, you get weight increase. Therefore, whenever we talk about the metabolism of carbohydrates and we talk about diets, my colleagues in the HU would always tell you that I always mention, after we talk about diet, the next word I talk about is exercise. You cannot speak about diet and nutrition without talking about exercise. And that has an immediate implications for what is happening in the pandemic, and we will talk a little bit about that again. Second slide, please, Kimberly. The relationship with sugars and NCDs is really quite profound, and scientifically, I don't think it can be challenged. In fact, we're learning more and more every day. You would see that many studies are taking place, but I've just referenced this one that showed a direct link with sugars. And at this point in time, I'm just talking about added sugars. This is the glucose and the fructose, which really are the byproducts of the metabolism of these carbohydrates. Now, that is a normal consequence of biochemistry. It is the added sugars that creates the problem. And you get those added sugars from manufacturers. What we have here, I just had a slide so people can understand that there's a direct link between when you consume excess added sugars and as you need the increased risk of type 2 diabetes, obesity, hypertension, coronary artery disease, and now we have known a number of cancers. So there's a direct link. So if you keep consuming these, what we call excess free sugars, these are the sugars that they put in these drinks and this food, this is the outcome. Second slide. The issue is linking the sugar, which we call the free sugar. And always remember the point that when you eat complex carbohydrates in our normal food, you get the production of sugars as an output. And those sugars are being made there to give us the energy. If you get sugars from complex carbohydrates, the other parts of the carbohydrates also have beneficial nutrients with it. But when you have free sugars, which is now bypassing that complex arrangement with respect to how we use carbohydrates and sugars and energy, you get excess sugars building up rapidly in the body. Research would tell us that the link between this excess sugar and sugar-sweet beverages is a direct one. Now, this is not an accidental thing by manufacturers. They are aware of it. What you're on the slide, you will see two things I put on the slide there. One, the fact that in the American diet, the #1 consumption of the excess sugars, sugar-sweet beverages, is soft drinks and fruit drinks. And you will see in the Caribbean, interestingly enough, in 2010, a survey was done, and we are seeing the same situation taking place, but we are seeing it by age and sex. Regional consumption of SSBs was highest in men age 20 to 39 in the Caribbean. At the country level, age 20 to 23 and Tobago. I would make a link here with some research that we have been doing in the health economics unit. And it's a link. What we have found when we have done some work for Grenada, this was also Antigua and St. Kitts, we will find with our epidemiologists, we were finding premature mortality in our men between the ages of 60 and 70 and 80. So our men, our males are dying faster. So when you look at this risk factor taking place here, and you also add to the fact that the men also consume excess alcohol, etc., you can see all the factors which is causing this premature mortality. So what we are talking about here is not a situation that is in the past, but is actively going on as we speak. Next slide, please. Now, even though this is a pictorial of what's going on, this is what I mentioned. This is the complex, this is just a simplification of what is taking place. The excess sugars, which is a production of the carbohydrate metabolism, but if you're putting free sugars into the sugar-sweetened beverages, the excess sugars if it's not utilized in the production of the energy, it is now metabolized by the liver into fats as a byproduct. It stores a little bit, and then you get the fatty liver. Now that fatty liver is what is the precursor for all the issues with the cardiovascular diseases and the diabetes, etc., etc. Now this is, just remember, it's a simplification. So the point we are making here is that, and I go back to my initial point, the metabolism of sugar in itself is to produce energy. Energy is something we need. So whenever we talk about eating and eating complex carbohydrates and eating sugars, we also have to speak about exercise, especially to our young people, for them to understand. You cannot just be eating, especially sugar eating, and sitting doing nothing. You will gain the weight, and we have been seeing the outcome of that all over the Caribbean with respect to when we do our studies on children. Can I have the next slide, please, Kimberly? Now, the fact of the matter that the sugar sweetened beverages have been identified, especially by the manufacturers, is not an accidental thing. Because what you realize is that when you look at what happens when you imbibe in these sugar sweetened beverages, they have effects on the individual. Now, it's a complex thing, but I would just simplify it by saying, as you consume these sugar sweetened beverages, it has an effect on your appetite control as an individual. And it also, because we call these calories, calories not from solid food, but not energy dense calories, there is a tendency by individuals to consume more and more of it in an attempt to satisfy your appetite control. And that is how you gain the weight. So it is not just a question of the actual product, but what the product is also doing to your physiology to allow you to consume more and more of it. The manufacturers are aware of this. I would also like to make a reference to a bit of information that I found, given what Kimberly had said in terms of the research. And that came out of the cancer research, World Cancer Research reviews, which identified that from 2014 to 2016 and onwards, the amount of sugar sweetened beverages in terms of manufacture and sale was decreasing in Europe, North America, and those other countries, what we tend to call the developed countries, and increasing in the less developed countries, including Asia and the Caribbean. Not only that, they were adding more sugars. So whereas they were losing income in North America and Europe, they were increasing their revenue streams directly. So this is a direct, I don't want to call it an attack, but it's a direct strategy by the manufacturers, and they're aware of the implications of these biochemical reactions I'm speaking about. Next slide, please, Kimberly. So this is the summary of what is happening in a quite simplified way. Added sugars is also associated with higher blood pressures. It gives you weight gain. It gives you diabetes. It induces the fatty liver. That gives you the increased risk of heart attack, strokes, and I can add a list of cancers. So there is no doubt of the relationship between these added sugars, diabetes, the cancers, etc. What is the point here? The point here is that we need to make sure to tell our young people, especially the children, because if you put this over the lifespan of people drinking sugar sweetened beverages from a child, and I also want to add something here, and the nutritionist who's on the program would bear me out on this. You are not, when you're born, you do not start off with a sweet tooth, because breast milk is not sweet, and you cannot remove breast milk from babies. They will fight you for it. So the question of sweet taste is a learned behavior, and similarly we can unlearn the behavior, because this is a dangerous thing for us. Next slide, please. We just want to make the point about the implications of this. sugar sweetened beverages and NCDs, and this is, I'm going rapidly here now, the NCDs in 2016 accounted for 75 plus of all deaths in the Caribbean. This is our tsunami. So we have two things going on in the Caribbean at the moment, the pandemic and the tsunami of NCDs. I'm putting these numbers here for people to see two things. One, it is all over. The numbers are great. So the economic burdens in St. Lucia is $27 million US, 2.4% of GDP. The next statement is to tell you the important point here is 2015 to 2030. We're in 2020. So the projection in the indirect cost of NCDs, including metal in Jamaica, is $17.2 billion US. This is serious, serious money. And the economic burdens for Trinidad and Tobago and hypertension is $1.29 billion US. So what you are talking about here, and as Professor Theodore and the economists will tell you, these kinds of numbers really are what is causing us not to be moving forward with development in other areas, because we are battling something that is preventable. Next slide, please.
2 minutes, Doc.
Thank you. I'm down to my mitigating risks. From a public health point of view, when we respond to something like this sugar sweetened beverages and the economics, we always say, keep your eyes on the prize. What is the prize? The prize is the reduction and the elimination of non-communicable diseases. That is the prize. We need to be careful that we focus on what we may call raising revenue or putting prices on products because they are not healthy for us. But we must always remember that is that raising revenue together with the other policy implications. We must learn from tobacco. The impact of tobacco came up with the stop smoking and the no smoking, not necessarily just because you raise the price of cigarettes. So on the policy responses, health promotion, health education for all. So people must be aware of what is happening, what to do. Reduce and change the taste of craving for sweets. What that means, do not do the substitutions. They say, let us use protein-like and other sweeteners. Do not do the substitution because the physiology, what I mentioned before, will continue. Balance diet and exercise throughout the life cycle. This is an issue that is from cradle to grave. This is not just an issue for young people or for the elderly. And towards that, we must educate each grouping so that they know what to do. Taxation, this is what we are talking about, SSSBs, and people will talk more about it. Food labeling and warnings, of course, if you know what you are eating and how to do these food labelings, you would know what to do. One of these things is that, I just want to mention it, you must always present an option and a solution outwards. The solution to the sugar sweetened beverages is water. Let me repeat it, not bottled water, but the water made by our government services. Once we have this water, we can add the sugar sweetened beverages, but water is the de facto default situation. Drink plain water from the pipe, but make sure that it is properly sterilized, etc., etc. Of course, we must collaborate with the partners in the manufacturing because we're talking about jobs, and they can do better in producing healthier products so that we reduce the sugar content and have a positive outcome. Legislation, and I'm sure that the nutritionists will talk about that, because in many countries, they've legislated this way forward if they don't get cooperation, legislation to ban some of these things so that we can get a positive effect. And of course, mobilization and partnership with civil society and organizations. So with that, I will end my presentation. I hope I kept it in my time, and thank you very much.
Thank you very much, Dr. Kamabach, for your presentation and making that link between sugar sweetened beverages and NCDs, and then taking us forward to look at some of the implications on health and the financing side of it. I would now move to our next presenter, Ms. Michelle Ash. Ms. Ash is the Chief Nutritionist and Head of Department at the Nutrition and Metabolism Division of the Ministry of Health in Trinidad and Tobago. She's been there since 2018. Previously, she was the Health Education Officer at the Division of Health Education. As she says, she's celebrating 12 years of working in the field of nutrition and dietetics and public health. She actually loves in her spare time to write. She's the author in a regionally published health magazine. So I would now like to hand you over to Ms. Ash to take us through her presentation. She's going to look at sugar sweetened beverage policy in Trinidad and Tobago.
Hi, good morning. Thank you for the introductions and the gracious, biography. That sounded so nice. Thank you very much. And thank you for having me here today to speak on the panel today with some updates with the Ministry of Health and praise our general public. So let me get up my slides so I can share. Okay, I think it is. Okay, everybody see my slides? Okay. All right, so this is
full screen?
Full screen?
Good.
Yeah, okay. Nice. So today we will be discussing sugar consumption policies and legislation in Trinidad and Tobago. Just a brief situation analysis and some just general background in terms of Trinidad and Tobago. We had the PAHO STEP survey that was done in 2012. And what this revealed is that we had a lot of risk factors that contributed to our high rates of chronic diseases in Trinidad and Tobago. Most notably, there was a lack of fruit and vegetable consumption. We had less than the recommended 5 servings of combined fruit and vegetable per day, with 91% of the population consuming very little to none. We had a very overweight as well as obese population. We had obesity rates of 25.7% in the country at that point in time. And these top causes of death in TNT still looks like this. In terms of heart disease, that's still the top killer. Then followed by diabetes, cancers, they're running close for competition. And we also have strokes. So this is basically what the health profile of Trinidad looks like. And with regards to sweet and our tastes, where does it really come from? We could associate that with our history with the sugarcane industry that was from roughly the 1700s to early 2000s. I believe currently was closed in about 2003, if I remember correctly. And you can tell that it had a huge impact on our food culture. Everything we like is sweet. We have a variety of sweets that we have here in Trinidad that is pretty much, indigenous to us. We sort of, created certain things. And then we share a lot of similarities with the rest of the Caribbean, with the sugarcane industry as well. So you would find that we gravitate towards sweet things in general. We like all our sauces sweet. We like food sweet. We like our ketchup sweet. We like everything. Everything we want to make it taste nice, we throw a little bit of sugar in it, right? And I'm sure you heard your parents or whoever was the person in the kitchen cooking that, to bring out the taste, you can add a little sugar, and of course, this has been to our detriment throughout the years, right? So what we found in terms of evidence is that a lot of our consumption actually comes from beverages in terms of added sugars. So I will just share with you brief evidence in terms of sugar consumption, SSB consumption in Trinidad and Tobago. So we have a lot of evidence for consumption of SSBs in youth that is roughly from about 13 years to about 17 or 18 years old. And we have two main sets of data that we tend to look at. The WHO Global School Health Survey is very, they take data on an ongoing basis, and you can find it on the WHO's website, and you will see the link below where you can actually download the data sets, and you can, do your own extrapolations and so on for the different age groups for the youth. And CFNI also completed a study in 2012 where they've revealed some information as well, and I'll show you in the next slide. So they conducted a study and they titled it Preventing Diabetes and Other Chronic Diseases Through a School-Based Intervention in 4 Caribbean Countries. Now, this was a study, sort of a longitudinal study where they followed children from like about Form 1 to about Form 3 or so, and they documented their consumption of the various food groups as they went along. And at the baseline, what they found was that the youth in Trinidad consumed the highest amount of sugar-sweetened beverages, and with about 63% of the youth consuming at least one sugary beverage a day. Yes, so you can see that there. So I'll go right on to the policy progress that we have in terms of tackling the issue of high consumption of SSBs. So one notable one that we've had a fair amount of success with is our ban on sale of sugar-sweetened beverages in school through the Ministry of Education. Now, what we did was we partnered with the Ministry of Education back in 2017, and we were able to set some certain guidelines, and it was really generalized guidelines. So in terms of anything with added sugar is basically not allowed to be sold or served in schools. And this pertains to all government and government-assisted schools throughout Trinidad and Tobago. So you're talking about no sale of soft drinks, no juice drinks, no flavored waters, no sports energy drinks. So what we will be able to sell is only 100% fruit juices. You're also allowed to sell, well, of course, water without saying low fat milk, blended fruit juices with absolutely no added sugar or sugar substitutes. So that was what was set out, and the Ministry of Health, through the School Supervisors Division, we've been receiving quarterly reports from the various school districts, and we have that monitoring in place currently. So in terms of the last reports that we were actually able to get, we had like about a 99% compliance rate for all primary schools. Well, that was for primary schools, and 97% for secondary schools. But we understand that we do have a flaw in monitoring, in that all of these reports are self-monitor reports that we get from the school principals. So we started discussions with HEU, and through specifically Dr. Kimberly and Gittins-Baines, we had some preliminary discussions for the last year or so, and we are trying to really get some type of unbiased monitoring to be put into place, as well as verification and so on. We were also discussing in Ministry of Health to implement health personnel to verify some of this data. However, that did not exactly come off, because we had some different things we were dealing with at the time, and different structural things we had to deal with in terms of job descriptions to see where it will fall under and so on, and then lack of personnel in some areas where the responsibility actually fell. So we have a few kinks to sort out, and COVID-19 is providing us with a little bit of an opportunity to put things in place before the start of the school term. So hopefully we should sort some of those things out before. And just a brief mention, we have a few other related policies in draft. We have a childhood obesity prevention policy draft, as well as we are currently revising the national nutrition, what we're calling the national nutrition guidelines for foods offered to children in schools. So this will incorporate everything else that was not covered in that policy ban on SSPs. So it will outline everything in terms of snacks, categories that are allowed to be sold, etc. And we will make sure that it will be also in line with the PAHO nutrient profile, which is a recommendation for the Americas in terms of processed foods and how we should classify it and different recommendations, etc. A brief note on health promotion and dissemination from the Ministry of Health. We've had a few health campaigns. The Healthy Me School Caravan, that has been something that has been active for a very long time. And then following that, we came out with the TT Moves public health campaign, and that has been running for about at least 2 years now. And we focus mainly on 3 things. Dr. Cumberbatch mentioned water, right? So we push drinking water every day. Also activity in all its forms, whether it's actual planned physical activity sessions or just being active as your general routine. And also emphasizing fruit and vegetable consumption, because as you can see in the first couple of slides, we had basically nil consumption in the population on a general. We also work with a lot of PTAs. We've had a lot of pre-carnival sessions. Now, all of this was, of course, pre-COVID-19. So there are a lot of things that we are revising. We are currently doing a lot of webinars for schools in terms of our focus in the health centers. We've actually gone back to focus on our primordial prevention methods. So breastfeeding, as Dr. Cumberbatch mentioned, is extremely important. It's an extremely important foundation because this basically sets the tone for humans. You know, they are not accustomed to having sugar, accustomed to breastfeeding. So our focus, we've really refocused during COVID-19 on having sessions in our antenatal clinics and our postnatal clinics. And we are making sure that we actually have that covered, because we know during this period, a lot of moms are not getting a lot of support. So we're really trying to give them that support as much as possible. We also have a lot of development of our health education materials, nutrition information, etc. We've rolled out the use of the WHO growth charts in the health centers as well. So you would see that most of the times, this should be standardized. We've also actually had the nutrition and healthy lifestyle quiz literally just at the cusp of COVID-19 shutting down our country. It literally was like the same week or the week before, if I remember correctly, in March. So that was held for primary schools. And then there are the host of nutrition related awareness health days that we observe in our country. Caribbean Nutrition Wellness Day, and it turns into the whole month in June usually, and so on. We have the entire list there. And that is the end of my presentation. I think I saw someone said that they would like to have the presentations after. I can send that to our facilitators and they can share it with the persons in attendance today. So thank you very much. That is the end of my presentation. If there are any questions.
Okay, thank you very much, Ms. Ash. And we will just hold questions for the question and answer segment. So I want to thank you for actually letting us know what is happening on the ground in Trinidad and Tobago. Oftentimes we talk about things that needs to be done, but this is actually happening in Trinidad and Tobago. So thanks again. We will now move to our next speaker, Dr. Miriam Alvarado. Dr. Alvarado is a Sir Henry Wellcome postdoctoral fellow with a focus on sugar-sweetened beverage taxation. Previously, Miriam completed her PhD at the University of Cambridge, where she conducted a multi-method evaluation of Barbados sugar-sweetened beverage tax. Dr. Alvarado has worked with the PAHO around health taxation and has been invited to speak at numerous regional and international conferences about her research. She has a background in economics and international development studies from the University of California, Berkeley, and a Master's of Public Health focused on health metrics from the University of Washington, Seattle. There is a lot more in terms of her qualifications, but in the interest of time, Dr. Alvarado, I'd like to hand over to you. Her presentation will be on sugar-sweetened beverage taxation in the Caribbean, rationale and findings from an evaluation of the Barbados SSB tax. I'm handing over to you, Dr. Alvarado.
Thank you very much for that lovely introduction, and thank you so much for the opportunity to be here with you all today. I suppose this will be no surprise to anyone on this call, and thank you to my colleagues for making this point so clear. But I wanted to highlight, when we're talking about SSBs, why are we focusing on them in the Caribbean in particular? And if you look at this map, it becomes clear, as we've heard earlier, that actually in our region, SSB consumption levels are much higher, in some cases 3 or even 4 times higher than they are in other parts of the world, which really means that we have an opportunity to make a big difference by targeting this type of food product. We've also heard about the evidence linking consumption of these sugary beverages with health outcomes in terms of diabetes, obesity, overweight, heart disease, etc. But perhaps something I wanted to highlight here is we've talked about how, from a health perspective, we look at sugar-sweetened beverages. How does industry look at sugar-sweetened beverage taxation? Some of you might be familiar with this slide, but for those who aren't, it comes from an internal document that was leaked from Coca-Cola. And in this graph, on this axis, they discuss the likelihood of these policies materializing. And on the y-axis, they discuss the potential impact such a policy would have on their business. And so you can see this yellow dot here corresponds to SSB taxation, new or increased product taxes. And this is one of the policies that they reckon has some of the highest likelihood of happening, but also some of the highest potential impact for their business. So this sort of corroborates what we know from a public health perspective, that these SSB taxes really have the potential to make a difference. But what's interesting here, and what I want to draw your attention to, is that this is an internal strategy document for Coca-Cola. And so they've superimposed their strategic response on each section of this graph. And you can see that when it comes to SSB taxation, their strategy is to fight back. So that highlights that this is something they really think is a threat, and also something that has the potential to really work. So with that background established, I wanted to share some ongoing work. So this was last updated in 2019. My apologies if it needs to be updated this year. But at least 6 countries in the region currently have SSB taxes: Barbados, Belize, Dominica, St. Kitts and Nevis, St. Vincent, and Suriname. And as you can see here, the structure of these SSB taxes varies quite a bit. So some of them are structured as ad valorem taxes, others are specific taxes. What that refers to is the design of the tax. So is the tax a percentage, 10, 20%, or is it a particular amount tied to either volume, so a few cents per liter, or to sugar content? And this has quite substantial implications, which I'll touch on in a little bit. So with that sort of regional overview, I wanted to focus in on the evaluation of the Barbados sugar-sweetened beverage tax. I'll start with an overview of the tax structure, and then share some findings from an evaluation that we conducted of changes in price, changes in sales, changes in consumer perceptions, and I'll conclude with a few thoughts and implications for the region. So starting off with tax structure, Barbados introduced a 10% tax, so an ad valorem tax, over 5 years ago now in 2015. So this was at a time when very few countries had introduced such a policy, and in fact, and the government of Barbados was one of the first 10 countries to do so. So this tax is applied to both locally manufactured products as well as to imported products. And taxable products were defined based on tariff code. So some of you might be familiar with the harmonized tariff code headings 2009 and 2202. So these are used to identify and classify imported goods. And I'll come on to why this is important in a little bit as well. In practice, what this means is that taxed beverages include things like sugary sodas, sports drinks and energy drinks, and sugar sweetened juice drinks. On the other side, diet sodas, 100% juice, bottled water, and powders or crystals were untaxed. When the tax was first introduced in Barbados, syrups were also untaxed. So for example, Mauby syrup wasn't eligible for the tax. In Barbados, this was amended a few years later. So you can see that Mauby has a different tariff heading, 2106. And so that's partly why these tariff headings are so important, because if there's any sort of loopholes, there might be products that we think of as a sugary beverage which aren't actually captured in the definition of the tax. So this is an example of closing that loophole. In terms of how these taxes are intended to operate, this is global evidence. So the idea, which is quite intuitive, is that a new tax should lead to a price increase, and that price increase should lead to a dampening in demand and consumption of that product. So we focused on this first part of the hypothesized causal chain. And in Barbados, what we found was that a 10% tax was associated with about a 5.96% increase in prices of sugary drinks and a 4.3% reduction in purchases of these same sugary drinks. So the overall message here is that the SSB tax worked. I'll show you these findings again in a little bit more detail. In terms of price, we were able to work with a major grocery store chain here in Barbados to evaluate price trends before the tax was announced and implemented, and then afterwards. And you can see here that the prices of sugary drinks increased quite a bit compared to non-sugary drinks, which stayed stable. So this is what we wanted to see, that there's some price differentiation between the sugary and unsugared products. And you can see that here on the Pine Hill dairy juices, where you do see that price differential reflected in the shelf price. At the same time, we looked at sugary drinks sold in a whole variety of store types, so not just grocery stores, but corner stores, kind of smaller retail environments. And what we found was that in a lot of cases, or at least in some cases, prices weren't clearly labeled, which means that if you're trying to promote a price change intervention, a tax, the impact might be diminished a little bit if consumers don't actually see the price at the point of purchase. So this might be an issue or an opportunity to improve the impact that this tax may have. Coming on to sales now, we were able to access quite a bit more data for the sales evaluation. And we were able to do a quite robust analysis using control countries and control products, controlling for the pre-existing trends, things like holidays, crop over. Tourism is a very big concern here in Barbados in terms of understanding the model output. So we were able to control for that as well. And the result of this analysis, as I alluded to earlier, is that the high level finding, we found a 4.3% reduction in the overall sales of SSBs, with reductions in both carbonated SSBs and other sweetened drinks. We also found an increase in the sales of non-SSBs, and in particular in the sales of bottled water. We mentioned bottled water before, so ideally people would be substituting to tap water, water available in their house, but we do see some evidence of people also substituting to bottled waters. From a health perspective, perhaps quite good. From an environmental perspective, a bit more complicated. We also, in this analysis of sales, wanted to explore an additional question, which is going into the details a little bit. Do we see evidence of people changing their behavior around expensive brands versus more affordable brands? So this has been hypothesized to happen, particularly following ad valorem taxes, or the percentage-based tax. And so we looked at the cheapest, sort of middle cost and most expensive SSBs. And what we found here in black is the trend after the tax was introduced. So amongst the most expensive SSBs, we see the biggest drop off in purchases over time. But actually for the mid-range SSBs, we see a slight increase. So this suggests to us that people are engaging in what's called brand down switching, where they react to a tax partially by reducing their overall purchases, but partially by actually substituting from the cheaper stuff to things that are a little bit more, or from the most expensive stuff to things that are a little bit more affordable. And from a health perspective, this is not what we want to see. So this is perhaps an unexpected consequence, again, which might be particularly incentivized given the tax design. There's interesting questions around why a government might choose to use an ad valorem tax versus a specific tax. I can say in Barbados, the IMF, actually a year prior to the introduction of the tax, released a report suggesting a 10% or an ad valorem tax on sugar-sweetened beverages. And so I think it's worth further consideration of what are the factors that kind of drive this structural choice. When it comes to perceptions, this is a piece of SSB tax evaluation that gets a bit less attention than price and sales, but is perhaps equally important. So did the tax have any impact on how people view these products? I showed you this logic model earlier, but we wanted to know, is there another mechanism through which the tax might operate that's not just through price? And we hypothesized that when a government introduces something like a tax or like the ban on serving SSBs in schools, like we heard about in Trinidad, does this signal to consumers that, oh, these taxes are being introduced for a health reason and these products are a health risk that should be perhaps moderated? So we interviewed a range of participants and found that almost everyone knew that the tax was applied to sodas and were quite well aware of the health risks with soda in particular. For example, one participant said, obviously, because I got diabetes, I shouldn't be drinking Coke, period. But on the other hand, a lot of people were unsure whether juices were taxed or not. So just to clarify, sugar-sweetened juices are included in the tax. Some people thought that they weren't taxed at all. And some people also shared the view that these juice drinks, sugar-sweetened juice drinks, were healthier than sodas, with one woman sharing with us, it would be more healthier on their bodies because they would go to boxed juice more than they would go to a Coke. It would be better. And this sort of obscures the fact that quite a lot of these sugar-sweetened juices actually have as much or perhaps more free sugar and added sugar than actual, Coca-Cola or some of these traditional sodas. What sort of impact did this have on sales? For soda, we see what we saw earlier, sort of this drop off over time. But for juice drinks, actually, we see an initial drop off and then kind of a return to original levels. So what might explain these differences? One participant summarized it really well when they said, when you think of the tax, you're going to think soft drink, but you're not going to think of that Pine Hill dairy juice that you've been buying your kids. So to me, this really encapsulates the fact that it's not just about price, it's also about conveying the message of why these juices are also included in the tax and the fact that they're not necessarily healthy alternatives, particularly the high sugar sweetened juice alternatives. We also took a look at how industry reacted. So we found that in the period before the tax was introduced in Barbados, there was really no kind of advertising along with the evening news program. But after the tax was introduced, there was quite a significant bump in advertising for things like juices, Milo, Glucerna, products that could maybe be portrayed as being healthy, even if they are quite sugary. You might be familiar with this jingle, but you can see that they're really emphasizing it's a natural product, it has no artificial sweeteners. And this is the same kind of language that we see mirrored in how participants talk about these products. Just one concluding thought here, we also found that industry reacted to the tax by introducing new products at a lower price point. So this black line corresponds to a new brand or new product line, Suntwist, which did really well, captured a large market share and came in at a much lower price, which might have undermined some of the impact of the tax. So these are some of the unexpected consequences to prepare for in advance if you're considering introducing or amending an SSB tax in your context. I'll just come to some concluding thoughts. One, we should have a discussion around tax structure, and these details really have an impact when it comes to the health incentives. Again, the same issue about what people's perception of a health risk is when it comes to sugar-sweetened beverages is an important one to consider. And my high-level conclusion is that we know that sugary drinks taxes work. The evidence from Barbados supports that finding as well. But as with most of these kind of policies, it's more complicated than it seems. There tend to be unexpected impacts, and we can work together to plan for them and preempt some of them by using other types of policies, bans on advertising to children, for example, or the work that we heard about that's ongoing in Trinidad. So thank you so much. This work was the product of a large team of collaborators, and I look forward to your questions.
Thank you very much, Dr. Alvarado. And again, an interesting presentation that tells us about what is happening in Barbados. Certainly a lot of work being done there. And so now we go into our question and answer segment. So it is limited. We'll only have a few questions and then we'll move on to our closing remarks. Dr. Alvarado, I'd just like to start with you since you're just finishing up your presentation. Tell us, what is the biggest takeaway from the Barbados experience thus far with respect to sugar-sweetened beverage taxation?
Sure. Well, I think the biggest takeaway is that it is possible to introduce this kind of policy, even in a country where sugar-sweetened beverage consumption is high, where there is a history of sugar production, et cetera. So these policies really can be introduced and they work, but they also need to be adopted with a whole of government approach. So the most powerful SSB tax would be one kind of co-designed by health and finance to make sure that it's meeting both goals.
Mm-hmm. Interesting. Okay, great. So health and finance is important and are important. Dr. Kamaraj, given that countries are grappling with the economic and health impacts of COVID-19, should sugar-sweetened beverage tax policy and taxation really be a priority at this time?
I think it should be, because what it identifies is the relationship between, especially in the Caribbean, between the pandemic and our epidemic that is going on. Because what we know from the pandemic is that people who have these comorbidities, that's the word we use, which really is diabetes, hypertension, obesity, et cetera, that they are the ones who have been carrying the burden of this epidemic. What I would also say that getting vaccines is not going to stop the implications of COVID-19 in the Caribbean, because we have an epidemic numbers of people with diabetes and hypertension. So what we're going to see as we go on, a vaccine is not going to just solve the problem with the infectious disease, but it may in fact continue a chronicity of the relationship with that and the chronic disease and obesity. So to me, it is an ideal time to introduce something like that, because when you introduce a tax, it allows you to get to the problem with a conversation with your population on what to eat and what to drink. We need to educate and inform people, especially our young people, who can make the change in diet with exercise, because we need to talk about this exercise given what the epidemic is doing with online learning, because our children are sitting even more now. So I will just end with that.
Okay, thank you, Dr. Kamabach. We have a question for Dr. Alvarado. How was the size of the tax determined in Barbados?
Sure, so the 10% tax, I don't have a very satisfying answer for that question. After the 10% rate was put forward, there has been some sort of stipulations from the WHO that a tax, to have an impact on health, should raise prices by at least 20%. So there is room for that rate to be increased, and for countries that are considering introducing a new tax to perhaps do so at a higher rate. I see a second question. Would it be all right if I address that?
Yes, that'll be fine. Go ahead.
I see a question about the design of the tax. So is it the design of the tax that has not seen companies changing recipes in response to taxation, and what would be a preferred design? So you're absolutely right. Right now, the tax in Barbados applies to any beverage that has any added sugar to it. So that means that companies aren't incentivized to reduce the amount of sugar, because once they have any added sugar, they're still going to have to pay the same tax. We see other tax designs in other parts of the world, like in the UK, South Africa, and Chile, where they have a tiered design or where the tax is intended to incentivize reformulation, either by having different tax rates based on sugar concentration, or by actually tying the tax to the amount of sugar per sugar grams per liter, as is the case in South Africa. And we see in both cases what happens is that companies reformulate to just under the threshold at which they can get away with paying a lower amount. So a lot of care has to be taken in considering what those thresholds are. It also requires quite a lot of administrative capacity to test and assess all the different beverages to identify where they should fall. So it is quite a burdensome, or can be a burdensome structure to implement, which is a practical consideration that needs to be taken into account.
Okay, thank you. Okay, so someone is asking, is taxation necessarily the best way to approach the issue? Can we use the curriculum in schools to address this issue? So maybe I can point that one to Ms. Ash, because you've done work in schools.
Yes. Hi, so we have done a lot of work in schools throughout the years, and there's only so much you can do with individual approaches. There comes a time where you actually have to recommend to your population certain things, and there are certain controls that will be a better public health approaches. For example, you yourself can look at how many fast food restaurants there are in a specific or a named urban area, right? Port of Spain alone, if you live in one of the communities in Port of Spain, you would see sometimes a Chinese food restaurant almost on every single block. And if there aren't government controls to regulate some of those things, you'd realize things get out of hand. Should there be stipulations, for example, when there are communities being built, is it necessary that the governments need to stipulate a specific amount of green space that should be allocated when those things are being built, those type of developments? So there's a lot that you can do with individual approaches, yes, and we are continuing to do those things also as we are considering things like that in Trinidad and Tobago. For example, we would like to implement a sugar taxation as well. However, we also have to put other things in place as well. For example, the cost of healthy eating is still extremely very high in Trinidad and Tobago, and we still do a lot of importation. So while we are considering the sugar taxation, we are considering also other approaches. So everything really works hand in hand. Yeah.
Yes, a holistic approach, definitely. So in the interest of time, I can only take one more question. So the question is, taxes are often transferred to the consumer. Are there any tax structures that target the profit margin of the SSB industry? I think I'd want to point that one to Dr. Alvarado.
Sure, thank you. That's right. So we do see the tax being transferred to the price that consumers are facing. To some extent, that's positive because it provides this price differential and incentive for consumers to substitute to something else. On the other hand, you're right that the structure of the tax perhaps is a bit lenient on manufacturers, because the tax is actually, in Barbados at least, is applied to the producer's price or the ex-factory price. So it's applied, 10% applied to a value that doesn't yet include the manufacturer's profit margin, nor the retailer or distributor's profit margin. So it's 10%, but it's not 10% on the final price. It's 10% on a much smaller value. So there are other ways of structuring a tax that would capture a larger proportion of that product's value.
Yes, and certainly consideration for countries that want to implement the taxes going forward. Okay, so there was one question about technical support. So like that person, possibly we can contact you or you can contact us. We do have we have done work at the Center here for Health Economics with respect to taxation, not only on sugar sweetened beverages, but also other products, alcohol and tobacco. So the university or institution do provide the technical support, and maybe we can talk further on that. I would now like to move to our closing remarks, which will be delivered by Professor Carl Theodore, Professor Emeritus, the HU Center for Health Economics. Prof.
Okay. Thanks very much, Chairman, Charmaine. And could you go to the first slide, please? I think that the discussion has been an interesting one, and I think I'm sure everybody is feeling what I'm feeling is we don't have time to really explore a number of issues that have been raised by the discussion. But I think the points touched, all the points touched, I think were points that were ones that all of us should take back and start thinking more seriously about, because what we're talking about is something that has an impact, not only on, it has an impact on us as individuals, but it impacts the country as a whole. And that's really what I want to focus on mainly in my closing remarks. I start by telling us that the UNECLAC has told us that what COVID will do us this year is to drop our GDP by about 10% in this region. Now, if we tend to scream and get very worried when our national income falls by 3 or 4%, you know, things get really bad and we get very, very nervous. And here we are being told that what's going to happen this year is probably a drop of about 10, so it's going to be very, very significant. Now, what that tells us, you know, is that anything we know we could identify that is pulling down our income, we need to do something. We need to really stop that from happening. The things that we know that are within our control, that are pulling down our income, we must stop it. Now, listening to Dr. Karamat and Dr. Alvarado to some extent, I think what came out very clearly was that the SSBs are linked to our non-communicable diseases, diabetes, hypertension, heart disease. They are linked, and they're a causal factor. And that the impact of these NCDs on our income is significant. In the data that Dr. Campbell's presented, somewhere between 2 and 5% of our GDP. If you put numbers on that for the region, you're talking about 1.6 billion US, between 1.6 billion and 4 billion. But it is worse than that. What I checked, you could check it, the Georgia State University, their public health school, did an interesting study recently in 2019. What they showed that was really scary was that the SSBs also impact on mental health. Now that means the issue, the impact of the NCDs, it is compounded by what happens to mental. In fact, what the Georgia study told us is that even one extra sugary drink a day increases your mental health risks. And we know that the data on the impact of mental health on the GDP is really phenomenal. And that 4% or 5% we're talking about that we have measured could easily become 10 and 12% because of the mental health impact. Okay, could you go to the next slide, please? So the point I'm making very quickly is that the GDP is our national income is a concern. We tend to think of the national income. If we want more national income, we have to invest more. We know that, but we also have data which tells us that the two biggest drivers of our national income are technology and our human capital. And when we talk human capital, we're talking really about education and health, the kind of knowledge and skills that people have, and the state of health that people have. Now, what COVID is hitting us very, very hard. And it means then that if it's hitting our income very hard, it means to say that we have to be careful about protecting our human capital. We have to do everything. We have to be aggressive is the word I'm using. We have to take many actions to really ensure that the things that are reducing our human capital, we are going to do something about it, because human capital is one of the main drivers of income, and we want, and since we're going through a period where our income is being pushed down by the COVID, we want to make sure that what we're doing are things that are helping the income to go back up. We don't want to leave things that are also pulling it down. This is my point, okay? And what the SSB is based on what Doc was telling, Dr. Thomas was telling us, the SSBs certainly seem to have the potential and to destroy our human capital, because if the SSBs could bring us into more diabetes, more hypertension, more heart disease, more of your cancers, it means then that the SSBs are really attacking us. They're attacking our human capital in a way that would cause our incomes to be in trouble. Could you go to the next slide for me? Question, what then do we do? I think we have to strengthen the work that the HU has been doing. We have to collaborate with our partners even more to make sure that the taxation message goes out. Now, I heard the question about taxation. Taxation is one of the many measures trying, but it is an important measure, and as Dr. Alvarado has explained, it really works. It causes consumption to fall. Now, it may not cause consumption to fall by as much as we want it to fall, but it is one of the many other things that we do. So we have to do more work to get the taxation message out there more clearly. But we also have to support the work that different agencies are doing on this question of labeling, and the HCC and CrossQ, they are doing work on it, and we have to support that kind of work, because labeling is also one of the instruments that we can use to make sure that we get a reduction. And finally, I think, and Dr. Karmach touched on it, legislation. Finland, I don't know if people know it, but Finland since the 1970s, Finland has been using legislation to indicate to manufacturers how much of what commodities goes into their foods. Right? Finland has been doing that, and Finland is one of the countries, all of us know, when you look at their NCD result, they are one of the few countries where the NCD curve is going downward all the time. Right? Now, it means to say that if we are serious, we have to take the legislation route much more serious. But I know the problem with legislation, and I think Dr. Alvarado pointed to that. The industry tends to react significantly. The answer to industry reaction is really evidence. We have to get evidence, more evidence to show what is damage that is taking place. And I think the bottom line, I think, is what I have in the last point, is that we have to become a region where we can show that public health is as much or more important impact on our food supply than profit making is. Because right now, let us be in no doubt, the main impact on our food supply is profits now. Profits is the main thing. Now, I am saying, okay, we live in a society where people are free to make profits and so on, but we must also be sensible and let public health, we have to raise our voices so that public health becomes an important determinant on what our food supply looks like. Now, what I am summarizing in the last slide. I am summarizing what I think to me is a frightening story. If you go to the last slide for me, you see what the last slide is showing you is that our national income depends on a few things. It depends on our technology and on our human capital. But from all the discussion you heard this morning, the NCDs, and people might wonder, well, how the NCDs impact on the technology. Well, it impacts on the technology because if people go into work are not healthy people, if people go into work as not in good health, then the use of the machinery or whatever technology is not going to be as effective. because the people using the technology are not in the best health, and therefore the impact of technology is going to be much more muted on the national income than it is supposed to be. And of course, the impact on the human capital impact is simply the impact from the people who are just too sick to go to work, or people who are actually dying because of these things. So the NCDs is attacking the two things that are driving our national income. And what's driving the NCDs is SSB consumption. So although people don't think about it, SSB consumption is linked to what is happening to our national income. And at that time, as I said, at the time now, when we have to be very careful and make sure that we don't have things that are pulling our income down, we have to make sure and concentrate on the SSBs. Now, having said that, following on what Dr. Alvarado said, and I looked at the results, and the results are interesting. From a qualitative point of view, the results are good in the sense that the tax, the 10% tax, led to a 4% reduction, I think. But when I asked myself, a 4% reduction in the consumption of SSB, what is the impact on health? Does that have any significant impact? In fact, we have to start thinking about 100% tax. Forget about the 10%. We have to send a message out loud and clear that SSBs are destroying our people and destroying our economic system. It's causing our incomes to be low, and therefore the message we're sending with 100% tax is that we really want to see a massive reduction in these things. So I think I want to end on that point, because I feel very strong about it, that the time has come when we have to try to get public health to be a major influencer of how we consume things in this region. Public health must be, profits right now is the main thing, but we have to bring public health center stage now, and the focus on the SSB is like opening the door for us here, and I hope we could do much more than that. So thanks very much, and I hope I have added one or two things for you to think about. Thank you very much.
Thank you very much, Professor Theodore. I think you summed it up nicely. So we're not tackling sugar sweetened beverages as a silo. It's actually impacting us in very different ways, right up to our national income. So all that's left for me to say is thank you to everyone. Thank you to the participants. It was certainly a pleasure to have you join us today on this webinar. Thank you to the team who put this presentations and everything, all the logistics together. And a big thank you to all of our presenters today. We've certainly invoked a lot of questions, a lot of discussion around the topics. So we look forward to you joining us at our follow-up webinar, where we'll be looking at other countries in the region. So thank you, and have a good afternoon, everyone.
Okay, bye-bye, everyone. Bye-bye.